Continuing with the topic, what is alga motus, liver motus, liver motus, and rigor motus, tachynoid, mummification, putrefaction. These are all important topics. So we have to come up to the chapter 13. Okay, we are now starting. So we have different important topics. What we'll be covering here is legal procedure, death and its medical legal aspects, postmortem changes, autopsy, mechanical asphyxia, thermal death, rectal injuries, starvation, identification, mechanical injuries, firearm injuries, regional transportation injuries. Okay, now let's begin with the so-called postmortem changes. In postmortem changes, we'll be discussing about the in postmortem changes, we'll be discussing about an important thing, that is rigor mortis, alga mortis, liver mortis. So we have different mortis, okay? Postmortem lividity. So what is alga mortis? Alga mortis is cooling of the body, that is chill of the body. Definition is cooling of the body after death is known as alga mortis. What is the mechanism? Mechanism, heat production in the body stops after death. Heat production of the body. Okay, talking about the alga mortis, so how is the thing? Definition is cooling of the body after death is known as alga mortis because the body stops producing heat, energy, calories. So that's why the body cools. So what is the mechanism of cooling? Heat production in the body stops after death. Body loses heat by all three mechanisms: conduction, that is whether touch, okay, convection, and radiation. Radiation is through the body difference, temperature difference, all these three happen. Okay, so until the temperature of body becomes equal to that of the surroundings. What is the factor affecting the rate of cooling? It is age. There are children and old people. They cool more rapidly because children they have more surface area, so they easily cool. Okay, what is the sex? Female bodies cool slowly because of more fat. So fat is a bad conductor of heat, so they cool slowly because they have more fat. What is the environmental temperature? If the environmental temperature is low, as in winter, so if we are in winter, so what will be there? And then the environmental temperature will be low, so cooling is very fast. In tropical countries, heat loss is 0.5 degree per hour. Tropical. So in tropical, 0.5 degree per hour. Covering of the body. Cooling is first, the body is clothed. The body is clothed and cooling is slow. Mode of death in case of death due to sunstroke. Body cools slowly because of sunstroke, right? So the body, because all the things were lost, the body cools slowly. Body size, obese bodies cool slowly because of more fat. Similarly, females, they cool slowly. Okay. Humidity and airflow. High humidity and strong airflow hastens cooling of the body. If more humidity is there and strong airflow hastens high humidity and strong airflow hastens the cooling of the body. Okay, measurement of temperature. Thermometer is used to measure rectal temperature. Normal temperature 36.5. Okay, what is the thermometer? Thermometer is nothing but it is a device. Thermometer is a device. It is used to measure the rectal temperature of the body. Okay, what is the normal temperature? Normal temperature is 36.5 degrees Celsius, 37.5. This is the rectal temperature. How to record the rectal temperature? So record the rectal temperature and you have to note the time, because the rectal temperature is most the valid one. Okay. At the same time, record environmental temperature. Record environmental temperature. Record environmental temperature. Okay. Reading is taken at 1 hour intervals to obtain the rate of fall of temperature. To obtain the rate of fall of temperature, what you have to do? Am I audible? Please answer. I'm seeing your chat. If you message, I can see it. So, reading is taken at a 1 hour interval to obtain the rate of fall of temperature. So, first, that is called Glaser equation. So, what is Glaser equation? Glaser. What is Glaser temperature? Glaser temperature. How will you record it? See, first you have to know the approximate time since the death. Okay, body temperature minus rectal temperature by rate of fall of temperature per hour. See, suppose the normal body temperature is 98.4, 98.4 degrees minus the rectal temperature. So suppose the rectal temperature has been fallen. Okay, it might be, suppose this is Fahrenheit. Okay, so suppose it is 90 degrees by the rate of fall of temperature per hour. Suppose it is 1.5 degrees Fahrenheit. Then you can calculate it. So this is the formula to calculate. It is not asked much, but if it is, we can know it is the normal body temperature minus rectal temperature divided by the rate of fall of temperature. This is the actual formula. This is called Glaser equation. Approximate time since death is. So this is to find out the time, approximate time, how much time has been happened based on the temperature. How can you identify how much time has been occurred after the death of the individual? What is the medical legal importance? So medical legal importance is you can know the time since death, approximate time since death. You can know the approximate time since death. We are discussing about alga mortis. What is alga mortis? Alga mortis is cooling of the body after death. Cooling of the body after death. Why this happen? What is the mechanism? Because the body do not produce heat after death. The body cannot produce heat, so it will lose the heat to different processes. That is conduction, convection, and radiation. Conduction is the transfer of heat by direct contact to the cooler object. Suppose a person is lying on the ground, so the body will lose the heat to the ground. This is conduction. Convection is transfer of heat through the air. So whatever air atmosphere is there, body will lose heat through the air. Another is radiation, transfer of heat via the electromagnetic waves to the EMB, electromagnetic wave. This is called radiation. This is called radiation. Okay, so what is postmortem? Uh, that is caloricity. So postmortem caloricity means increase in body temperature after death. This is very unknown thing. That is why the temperature is increasing. Normally, what happens? The temperature falls. So instead of falling temperature, if there is rise in temperature, it is called postmortem caloricity. So postmortem caloricity, what are the causes? Causes is infectious diseases. If any infection is there, like septicemia, tetanus, rabies, peritonitis. What is CNS damage? Brain hemorrhage, injury to hypothalamus, toxic causes like strychnine poisoning, carbon monoxide poisoning, excessive muscular activity before death, example conversions in epilepsy, mechanism continuous oxidation and metabolic activity in tissues, especially in bacterial infections, generate heat. Muscle contractions and enzymatic reactions also contribute to rise in temperature. Forensic importance can lead to misinterpretation of time since death. So if there is a caloricity, postmortem caloricity, then it means that the patient there is a uh, misinterpretation. The patient might have increase in body temperature rather than the decrease in body temperature. So the approximate times in death can get wrong. So observe within the first 2 to 3 hours of death. Observe this forensic importance is of postmortem caloricity. What is postmortem caloricity? Increase in body temperature after death. Normally what happens? Alga mortis happen. That is decrease in body temperature, cooling of the body after death. But if there is rise in body temperature, there might be infection in the body like septicemia, tetanus, rabies, peritonitis, or maybe because of brain hemorrhage, injury to the hypothalamus, maybe because of some toxins like strychnine poisoning, carbon monoxide poisoning, excessive muscular activity before death like convulsions in epilepsy. What is the mechanism? Continuous oxidation and metabolic activity in tissue, especially in bacterial infections, generate heat. What is the mechanism of increasing body temperature? Because of the oxidation, because of the metabolic activity in tissue, because of the infection, the temperature may rise. Muscle contractions and enzymatic reactions also contribute to rise in temperature. What is the forensic importance of postmortem caloricity? That is misinterpretation of time since death and observe within the first 2 to 3 hours of death. So this is observed within first 2 to 3 hours of death. Okay, so what is the thing here? So listen here carefully. What is alga mortis? Alga mortis is nothing but post-mortem cooling. That is cooling of the body after the mechanism is after that body stops producing heat. There is no heat after death. Since there is no heat, what will happen? The body will cool. The body will lose heat energy by three mechanisms. Conduction. Conduction is because of the contact between the body and the substance or because of the contact, the body will lose heat. And there is convection. Without any contact, also through air it can lose. Then is radiation. Radiation is without air, without anything, can lose heat. So conduction, convection, and radiation. If you find some space, right? Yeah. So what is alga mortis? Alga mortis is cooling of the body after death. Cooling of the body after death is called alga mortis. Done. So mechanism is body stops producing heat after death. Because of that, it loses heat by conduction, convection, and radiation. And body loses the heat unless until it is with equilibrium with the environment. Equilibrium with the environment is important. See, if the body is normally we maintain our normal temperature, right? We are in the homeostasis. Normal temperature of body fluids we maintain when we are alive. But after death, what will happen? Everything will change. No ATP production, no heat production. So body is like suppose this is 98.54 Fahrenheit, it will, the temperature of the environment will get reduced. So there are many factors which influence the rate of cooling of the body, like age. Like in children, more surface area, they lose heat more rapidly. Old age people, they don't have much ATP. Okay, another thing is gender of the body. Female bodies, they have more fat when compared to men. So male body will be cooled slowly, whereas female body, because of the more fat, they will cool slowly. Female body will cool slowly because of the more fat, because fat is a bad conductor of heat. Another is environmental temperature. Suppose the body is in some cool area, then it will cool more fast. Suppose it is winter, it will cool more fast. What is the covering of the body? If the body is covered with the thick clothes, then it will not heat, not lose heat very quickly. Okay. Another thing is body size. Obese bodies cool slowly because of more fat. Okay. Another thing is measurement of temperature. See, based on the temperature of the body, you can determine how much time since death. What is the time since death? Okay, what is the time since and death based on the okay. So let's see. So there is a device called thermometer, which is useful to measure the rectal temperature of the body. Okay, so to record, first you have to record the rectal temperature of the body. Okay, at different intervals. Usually it is taken in the interval of 1 hour. 1 hour interval, the temperature is recorded. So then you can find out the rate of fall of temperature per hour. Rate of fall of temperature per hour. The approximate time since death, how will you find out? Time since death, how will you find out? Normal temperature, normal body temperature minus rectal temperature by rate of fall of temperature since 1 hour. Okay, this is the approximate time since. What is the medical legal importance of alga modus? It will estimate the approximate time since death. It will estimate the approximate time. It will know the approximate time since death. Okay. Okay. Another thing is, if environmental temperature is high, then the rate of cooling of the body will be slow, minimal. Whereas if it is winters, the rate of cooling of the body will be fast. Okay, what is postmortem periodicity? We are finding the time since death based on the temperature. What is this formula called? First of all, this formula is called Gleister equation. Gleister equation. This formula is called Gleister equation. Gleister equation. Gleister equation. Okay. What is the sometimes what will happen because of the septicemia or some infection, tetanus, rabies, peritonitis, toxin based strychnine poisoning, carbon monoxide poisoning, brain hemorrhage, injury to the hypothalamus. Because of these things, what will happen? The body will, instead of getting cool, it is more, the temperature is more. So this is called postmortem caloricity. So these are the things which will influence the temperature of the body. Now having done with the alga motis, one second. Okay, so sorry for this. Let's see now what is liver motif. Liver motif. We have discussed the postmortem cooling of the body, that is alga motif. Now let's see the liver motif. Let's see the liver motif. Next we will be dealing with the Riger motif. So we have three. We have three alga motifs, liver motif. So the other terms used for liver motif is postmortem hypostasis or postmortem lividity. Postmortem lividity. Another term is postmortem lividity, postmortem hypostasis, and liver motif. Liver motif. Liver motus. Liver motus. Other term is post-mortem lividity. Lividity. What does it mean? It is also called post-mortem staining or suggulations or vibices. There are different terms used for it. Okay. So what is liver motus? That is bluish purple discoloration of the skin after death is known as post-mortem lividity. Bluish color discoloration after death. Bluish purple color discoloration after death is called the post-mortem lividity. They change the color. It is seen in dependent parts of the body as a result of stagnation and collection of blood in the capillaries and veins due to gravity. See, that is post-mortem lividity, that is post-mortem discoloration of the skin. The skin, normal skin is brown yellow, but it will turn into what? Bluish purple. And these bluish purple is seen on the dependent parts of the body. Dependent parts of the body. Dependent parts of the body. As a result of stagnation and collection of blood in capillaries. As a result of stagnation or collection of blood in capillaries and veins due to gravity. As a result of stagnation and collection of blood in capillaries and veins due to gravity. As a result of stagnation and collection of blood in the capillaries and veins due to gravity. Due to gravity, there is a collection of blood. There is a collection of blood in veins, capillaries. Because of that, in the dependent part of the body, there is a bluish purple discoloration. Okay. Okay. So back after break, so we are discussing liver motifs. The other names are postmortem lividity, postmortem hypostasis, postmortem staining, circulations, and vibices. So there is a bluish purple discussion of the skin on the dependent parts of the body due to collection or stagnation of blood because of gravity into capillaries and veins. Okay, hypostasis is also seen in internal organs like liver. Hypostasis stoppage of blood, liver, kidney, heart, lungs, and stomach. What is the mechanism? Stagnation of blood after death. Stagnation of blood after death. So there is a stagnation of blood after death. This is stagnation of blood after death. Okay, collection of blood in the capillaries and veins due to gravity. Due to gravity. So stagnation of blood after death, collection of blood in the capillaries and veins due to gravity. Stagnation of blood after death because of the collection of blood in capillaries and veins due to gravity, because of the gravity. What is the site dependent parts of the body? The body is hanging. Then postmortem will be seen in hands and feet. If the body is hanging, it is seen in hands and feet. If body is supine position, lying on the ground, then postmortem is seen in the back of neck, back of thorax, buttocks, flanks, posterior aspect of thighs, calf, and heels. Okay, the body is prone. Postmortem lividity is seen in front of chest, face, and eyes. Body is lying on one side, lividity is seen on that side. Okay, wherever the pressure is there. Any pressure prevents the filling of capillaries. Areas such as collar around neck, waistband, okay, belts, wrinkles in the clothes are seen as pale bands and are known as gibbouses. It is also seen in intestines when the intestine is stretched, alternate bands of pale and stained area is seen. Blanching or pallor is also caused by the pressure of one part of the body or other, in which case mirror image blanching is seen. Body areas in contact with the floor ground also show blanching, known as contact pallor. What is development of lividity? What is shifting of lividity? What is the color changes in lividity? What is the medical legal importance? What is the difference between hypostasis and congestion? So these are all things are there. Okay. So talking about the site of a postmortem lividity. The site is dependent parts of the body. If the body is hanging, suppose if the body is hanging, where will you see the lividity? If the body is hanging, you will see in the arms and legs because of the gravity, the fluid will flow down, right? If the body is hanging, you will see in the arms and legs. If the body is hanging. Okay. If the body is hanging, you will see there. If the body is not hanging, the body is not hanging. The body is just supine, lying on the ground. Then back, neck, hands. You can see if the body is prone, then chest, face. What are the dependent parts are there? You will see there. If the body is lying on one side, so lividity is seen on that side. Now talking about any pressure prevents the filling of capillaries. If there is no filling of capillaries, then what will happen if there is no filling of capillaries? Areas such as collar around neck, waistband, belts, and wrinkles in the clothes are seen as pale bands known as gibbouses. Then it is known as gibbouses. Gibbouses are pale bands. Pale bands. Okay. It is also seen in intestine when the intestine stretches alternate bands of pale and stained area. Blanching or pallor is also caused by the pressure of one part of the body over other, in which case mirror image blanching is seen. Body areas in contact with the foreground also show blanching known as contact pallor. So pallor can be seen because of one part of the body is having pressure on other part. So in which mirror image blanching is seen. And sometimes there is a pallor. Okay, now let's talk about the development of lividity. It is well developed within 4 hours. How much time is required for lividity? 4 hours. 4 hours is required. 4 hours is required. 4 hours and persist until putrefaction sets in. Intestine is more in depth due to asphyxia. Intensity is more in depth due to asphyxia. If there is asphyxia, because the patient was not able to breathe because of asphyxia, then it is more. Intestine is less in intensity is less in depth due to anemia. The patient is not having blood, so no stagnation, no hemoglobin, anemia and hemorrhage. Hemorrhage already fluid is lost if blood is lost, so less stagnation. So in this case, postmortem lividity is high. In this case, postmortem lividity is low. What is patchy areas unite to produce extensive discoloration? So there is a patchy area. Patchy area. So patchy area जो है unite to produce extensive discoloration. Extensive discoloration. Okay. Dull red patches about 1 to 2 centimeter diameter appear in half to 1 hour. 1 to 4 hours. Increase intensity. Become confluent. 6 to 12 hours. Maximum intensity and maximum extent. Shifting of lividity. Shifting. Shifting of lividity. What is shifting of lividity? If the posture of body is changed within few hours after that, lividity shifts to new dependent parts. This is known as secondary lividity. Shifting may be complete or incomplete. Lividity appears slightly in the new area. So the posture of body is changed within few hours after that, lividity shifts to new dependent parts. This is known as secondary lividity. However, what is fixation lividity? Lividity cannot be. Another is fixation. Fixation lividity cannot be shifted after 6 to 12 hours. This is known as fixation. After 6 to 12 hours, no shifting. No shifting, okay? That is fixation. Lividity cannot be shifted because blood cannot pass out of blood vessels due to hemoconcentration. Rigor mortis obliterates blood vessels. Blood leaks into surrounding tissue due to hemolysis. Color changes in lividity. Normal reddish purple, asphyxia bluish purple, aniline deep blue, carbon monoxide cherry red, hypothermia pink. So this is the color of the blood actually. Okay, so these are the things. So we have discussed about postmortem lividity. What is the differential diagnosis? Just a minute. Okay, next is mummification. Next is what is the difference between hypostasis and congestion. So appearance of bluish purple irregular patches is known as hypostasis. Mucous membrane is dull and lusterless. Exudate is absent. A hollow viscous like stomach and intestine. Alternate stained and stained areas. Congestion redness is uniform all over the part or organ. Normal mucous membrane is seen in congestion. Exudate present congestion and hollow viscous like stomach and intestines have uniform staining. So what is the difference between hypostasis and congestion? What is hypostasis? Bluish purple, bluish purple discoloration, irregular patchy areas, right? Congestion is redness is uniform all over part or organ. Redness is uniform. Hypostasis, mucous membrane. How is the mucous membrane? Dull, lusterless. Dull and lusterless. What about here? Normal. Normal mucous membrane. Exudate, not there. Hypostasis, congestion, there. Hollow viscous organs show alternate stain and unstained. Alternate patches, stained, stained area, unstained. Here stained, unstained. Here equally stained. Okay, so this is the thing. Okay, next we'll discuss what is the medico-legal importance of liver motis or postmortem lividity. Okay, it is a sign of death. Sign of death. First of all, the lividity is famous sign of death. Approximate estimation of time since death. Time since death, because lividity is fixed after 6 to 12 hours. 6 to 12 hours lividity is fixed. Means there is no shifting. And it is developed within lividity is developed within 4 hours. Within 4 hours it is developed. 4 hours it is developed. 1 to 4 hours intensity will increase. Then 6 to 12 hours maximum is in maximum extent. After 6 to 12 hours fix. Okay. So it will tell you time since the approximate time. Okay, indicates posture of body because dependent parts, if it is supine back will be there. Posture. That is indicates shifting of their body. Shifting of dead body. Different color indicates different types of poisoning. Like if there is a normal color, what will be there? Reddish purple. But if it is asphyxia, bluish purple. Because in asphyxia, the person cannot breathe. So that's why deoxygenated. So bluish purple. Carbon monoxide is cherry red because all the hemoglobin is bound with the carbon monoxide. Cherry red. Hydrocyanide poisoning, bright red. Bright red. Bright red. Clostridium perfringens, bronze color. Clostridium is bronze color. Bronze color. Welchii, grayish color. Phosphorus nitrite, brown in color. If phosphorus and nitrite is there, phosphorus and nitrite, it is brown in color. Okay, septicemia, if there is any septicemia, it is sulfur hemoglobin. Decomposition, black. Okay. Now let's talk about rigor mortis. Should be definition of bruise and hemorrhagic spot due to discrete infections. Muscular changes. What are the muscular changes after death? Muscular changes. Primary flaccidity, secondary flaccidity, rigor mortis. So in this only we'll cover rigor mortis, Staten rule and rule of 12. Rule of 9 we have heard in Burns. What is primary flaccidity? Primary flaccidity. Primary flaccidity. What is primary flaccidity? What is secondary flaccidity? What is rigor mortis? So primary flaccidity means Soon after death, somatic death, all muscles relax. As soon as all muscles will relax. Joints are flexible and lower jaw falls. Soon after death, what will happen? All the muscles will become loose. Joints become flexible. You can rotate it any up to 280 degrees center. Flexible. Flexibility will increase. Lower jaw will fall. So mouth will be open. Body flattens over the area which are in contact with the surface. Contact flattening. Muscle responds to the mechanical and electrical stimuli. Peristalsis, ciliary movements and movements of WBC present. Chemical process in liver cells may continue. People react to atropine but not to light. Atropine. Pupil reacts to atropine but not to light. Tendon reaction, that is Vasquez phenomena, is seen. This is seen up to 1 to 2 hours after death. Strike the quadricep muscle about 10 centimeters above the patella. Patella is there, na? Not the knee joint. Strike it. Strike the patella by reflex hammer. So muscle will contract. This is called Vasquez phenomenon. So this is seen within 1 to 2 hours. So once again, let me clarify what is Vasquez phenomenon. What is Vasquez phenomenon? Strike the quadriceps, strike the quadricep muscle 10 to centimeter above patella. Patella ke above, you'll find the quadricep tendon. Patella ke above. How much above? 10 centimeter above, you'll find quadriceps muscle. Quadriceps muscle. Okay, strike that muscle by reflex hammer. You will see the muscle contraction. This Vasquez phenomenon is only lasting for 1 to 2 hours. 1 to 2 hours only. Tendon reaction, Vasquez phenomenon. Okay, people react to atropine but not to light. So people will atropine. What will happen? The pupil will become small. Chemical process in liver cells may continue. Peristalsis, ciliary movement and movement of WBC. Muscle responds to mechanical electrical stimuli. Body flattens over the area which are in contact with the surface. Contact flattening. Joints are flexible and lower jaw falls. Mouth will be open, joint is flexible, muscles are loose. Okay. Secondary flaccidity. This secondary flaccidity. Primary within 1 to 2 hours, and you can also see Vasquez phenomenon. What is secondary? Secondary thing. Secondary is as putrefaction sets in, muscle become flaccid due to action of enzymes. What is due to action of putrefaction sets in, muscle becomes flaccid due to action of enzymes. Enzymes which dissolve the myosin. Secondary flaccidity. What happens in secondary flaccidity? Secondary flaccidity, as putrefaction sets in, muscle becomes flaccid due to action of enzymes. Due to action of enzymes. Due to action of enzymes, muscle will become flaccid. So muscle will become flaccid. Muscle will become flaccid because of the action of enzymes. They dissolve the myosin. So secondary flaccidity because of the enzyme action, muscles will get dissolved. The myosin will get dissolved. Now coming to our topic, rigor mortis. What is rigor mortis? What is Miscaton's rule? What is rule of 12? Okay. We have seen Vasquez phenomenon, right? 10 centimeter above patella, if you strike with the quadriceps muscle to the quadriceps muscle with the reflex hammer, you will get the muscle contractions. It is between 1 to 2 hours only. What is mechanism? Stimulus. What is rigor mortis? Stiffening of muscle after death, after cellular death, stiffening of muscles. So we have muscles, we have myosin, we have actin filaments, right? Myosin is single at the center, and we have actin in the sides. This is actin, and this one is myosin. This is actin. So mechanism is stimulus. Nerve impulse. Actin filaments are drawn into myosin filaments. Okay, like piston into cylinder. Muscle contracts. ATP is required for the relaxation of muscles. So here, actin will come close. So stimulus nerve impulse. Actin filaments are drawn into myosin. So actin filaments drawn into myosin. Actin filaments are drawn into myosin filaments. So there is a thing like this. Myosin filaments are there here. Like this here, actin filaments. So here some space is there, but this will cover the space in during contraction. So to get back from this contracted to relaxation position, it needs ATP to be bind, but ATP is exhausted because now body is not producing ATP after that. But after that, ATP is destroyed, therefore no relaxation of muscles. The calcium ion pump fails, relaxation of muscles. Accumulation of lactate, muscles become rigid, therefore rigor mortis sets in. Onset and duration, it begins in 1 to 2 hours after death and takes further 1 to 2 hours to develop. 2 hours to develop. Rule of 12. Rigor mortis takes 12 hours to develop fully. Fully contraction 12 hours. It stays for 12 hours. Yeah, it stays for 12 hours. It takes 12 hours. It stays for 12 hours. And it takes further 12 hours to disappear. So fully developed 12 hours, stays for 12 hours, further 12 hours to disappear. This is known as March of rigor. 12, 12, 12. March of rigor. Factors influencing rigor mortis. We also need Liston's rule. According to Liston's rule, he was a French scientist. Rigor appears first in the muscle which are nearest to brain and appears last in the muscles of others. So first eyelids, after eyelids which muscle? Jaw. The jaw is open, right? Lower jaw called thorax, then upper limb, then abdomen, then lower limb. Then involuntary muscles, cardiac muscles. So rigor mortis first appears in cardiac muscles. Erector pili muscles forms cutis and serina or goose skin. Pupils contracted, not reacting to light. Test is drawn up. Semen may be forced out of seminal vesicle. Uterus, if we contract, may expel the fetus. If the mother died but the fetus is there, it will be expelled out due to contraction of uterus. Okay. Due to contraction of uterus, fetus will be expelled out after death of the mother. And if there is any semen, so the testis will be drawn up and semen will be forced out of the seminal vesicle. Okay. First involuntary muscle to get contracted is cardiac muscle. Rigor mortis first appears with the cardiac muscle and it lasts for longer in the uterus. The uterus, it will contract and expel all the fetus out. What are voluntary muscles? That is proximo-distal. It begins in the eyelid. So the order is like first, which is close to the brain, eyelids, the lower jaw, neck, upward to the facial muscles and downwards to the muscles of chest, upper limb, abdomen, lower limb, fingers and toes. Passes off in same order. Okay. Same order. First eyelids, from their contraction will go, then lower jaw, then neck. That's why after that what will happen? Jaw will be open immediately, like around 1 to 2 hours after that. Okay, what is the medical legal importance of rigor mortis? Rigor mortis. What is the medical legal importance? It is a sign of death. It is a sign of that death has been occurred, and that's why it is a contraction of muscle. It indicates time since death. It will indicate how much time. So if you want to find out how much time has been happened by seeing the contraction, you can find out that this if full contracted body is there, then it is 12 hours. 12 hours it will take to get into complete contraction to develop fully. 12 hours to develop fully, then it stays for 12 hours, then further 12 hours to disappear. So it indicates the time since death. It indicates posture of body at the time of death. It can also say the posture. Like in liver motive, same. Liver motive is time since death, posture, and is a sign of death. Liver motive is medically important and rigor motive same only. What is the differential diagnosis or condition stimulating rigor motive? So marked rigor rigidity is seen in death due to burns. Death due to burns. Death due to burns. There you will see more of the rigidity or electrofusion. If someone died because of electric shock, electrocution, there also the body will be more stiffed. If there is hypothermia, if the body was hypothermia or less temperature, the cool, then also there is more stiffening. Okay. Other thing is heat stiffening. During heat stiffening, if person is having heat stiffening, then also the body will be contracted. Cold stiffening, there also body will be contracted. Cadaveric spasm, there also the body will be contracted. Cadaveric spasm and rigor mortis, what is the difference? In cadaveric spasm, there is immediate contraction of muscles. Whereas in rigor mortis, it starts after 1 to 2 hours and it will take fully 12 hours to complete. What is cadaveric spasm? What is cadaveric spasm? Muscles which were in contraction at the moment of death remain in contraction without primary relaxation. Is a mechanism obscure and may be due to neurogenic cause, adrenocortical exhaustion, and ATP depletion. Muscles involved usually a group of voluntary muscles like hands, rarely entirely bodies involved as in case of soldiers shot in a battle. Medical legal importance of cadaveric spasm, same 19 death, all that, okay. In cases of deaths due to drowning, there grass, gravel, weeds are firmly gripped in hands. If it is case of drowning, in the hands you will find gravel, grass, weeds. Suicide, pistol, knife is firmly grasped in the hands. Firmly grasped, okay. Homicide, hair of silent. Clothing, buttons are held in hands. There's a homicide if the person is trying to, catch the criminal. So what will help you happen? The hairs or buttons or cloths of the assault maybe in the hand, held in hands. Okay. What are the predisposing factors for cadaveric spasm? Excitement, exhaustion, severe pain, injury to the nervous system, convulsions such as epilepsy, strychnine and tetanus, fear, drowning, cerebral hemorrhage, firearm wound of head. Because of this also the cadaveric spasm takes place. How will you differentiate between cadaveric spasm and rigor mortis? Cadaveric spasm and rigor mortis. So muscles involved in rigor mortis is all muscles. All muscles are involved. Cadaveric only some muscles like hands are involved. What is the mechanism? Here rigor mortis because of the ATP depletion. In cadaveric, it is not very clear. It could be because of the excitement, exhaustion, fear, all that. Rigor mortis onset after 1 to 2 hours, whereas in cadaveric spasm, instantaneous. Primary relaxation is seen in rigor mortis, no primary relaxation in cadaveric. Predisposing factor and not any predisposing factor. Here, excitement, fear, exhaustion. Conditions stimulating it, heat and cold stiffening. Here, none. Temperature of body in rigor mortis cool because it occurs after 1 to 2 hours and totally it takes 12 hours. Here, warm. Molecular death in rigor mortis occur. Here, not occurred because immediately cadaveric spasm occurs. Electrical stimuli, muscles show no response in rigor mortis. Here, muscles will respond to electrical stimulus. Muscle stiffening not marked here, marked difficult to break. Medical legal importance indicates time since death, indicates suicide, homicide, or accidental death. Okay, So this is about our rigor mortis. Okay. Moving further, what is decomposition? What is decomposition? What is decomposition? Decomposition. Decomposition. Decomposition, it is disintegration of the body. Decomposition of the body takes place by two methods. What are the two methods? One is autolysis. It is by the digestion of tissues by enzymes. Another is the putrefaction by bacterial action. What happens in autolysis? After death, breakdown of cell membrane, release of proteolytic, glycolytic, lipolytic enzymes, autodigestion of brain and other tissues. Like maceration of fetus. Freezing and heating halts the process. Putrefaction takes place in three stages. First, color changes. After color changes, formation of gases and liquefaction of tissue. What is the mechanism? Clostridium welchii and other bacteria, the streptococci, staphylococci, diphtheria, B. proteus produces enzyme lecithinase, breaks the cell walls of RBCs and other cells putrefaction. Color changes. Marbling. Let's discuss adiposity in detail, mummification in detail. Tachinoid we have discussed. Artifacts we have to discuss. So let's see what is adipose seed or saponification. So adipose means fat and seed means wax. Okay. So it is fat converts into wax. So fatty tissue of the body change into soap-like substance. It's called adipose seed. Appearance: it is soft initially and later become hard, wax-like. It is brown in color with ammonical odor. The odor is ammonical. First is soft, later becomes hard, wax-like. What is the mechanism? Fat is olein. Hydrolysis hydrogenation occurs in the presence of intrinsic lipase and bacterial enzymes. Higher fatty acids, example adipose, oleic acid, palmitic acid, stearic acid is formed. Higher fatty acids are formed. Oleic acid, palmitic acid, stearic acid. Factors favoring adipose seed formation. What are the factors which favor the adipose seed formation? Water necessary for bacterial enzymatic action. Hot, humid and aerobic environment. Females and obese person contain more fat. Fetus less than 7 months, no adipose seed formation because no fat. More common in buried bodies can occur in infants. Side subcutaneous tissue, face, buttocks, breast, abdomen, upper and lower limb, liver, kidney, heart, skeletal muscles, the entire body. Mainly subcutaneous tissue, vertices and buttocks, breast, abdomen. Time required 3 weeks in temperate countries in summer. 3 weeks for adipose seed formation means less than a month. In temperate countries in summer, a limb takes about 3 to 6 months for complete conversion. Medical legal importance: identification. If face is well preserved, so it will be for identification. Time since death can be estimated if it is 3 weeks, then medical has taken place. Cause and manner of death can be known. Injuries are preserved. Burial and disposal clues like common in waterlogged graves, steel coffin, submerged body, etc. Soap lady. A 19th century woman was found in USA who was completely converted into adipose. Rarely whole body convert, so it was soap lady. Now next, mummified bodies. What is mummification? What is its medical legal importance? Mummification is drying and shrinking of dead body due to evaporation of water. Natural and artificial. Natural, like hot and dry weather, rapid evaporation of water from the body. Body becomes dry, brown and leathery. Mummification. Internal organs also shrink and become hard and black. Artificial, it was practiced in ancient Egypt to protect the body. They remove all the moisture from the body, apply medicines and wrap the body. Mechanism of natural is hot and dry weather, rapid evaporation of water from the body. Body becomes dry, brown and leathery. Mummification. Internal organs also shrink and become hard and black. Internal organs also shrink and becomes hard and black. Artificial for practice in ancient Egypt to protect the body. They remove all the moisture from the body, apply medicines and wrap the body. Factors favoring mummification. Hot and dry weather. Bodies buried in hot, dry, sandy places with hot, dry winds. Desert. Dehydration, emaciation before death. Dehydration, emaciation before death. Factors favoring mummification, hot and dry weather. Bodies buried in hot, dry, sandy places with hot, dry winds, deserts. Dehydration, emaciation before death. Site exposed parts like face, upper and lower limbs get mummified first. Face, upper and lower limbs get mummified first. Later, entire body, including internal organs, get mummified. Site exposed parts like face, upper and lower limbs get mummified first. Later, entire body, including internal organs, get mummified. Time required 3 to 6 months is required. For adipose seed, only 3 weeks. But for this, 3 to 6 weeks. Months. Months is required. 3 to 6 months. Medical legal importance, same as the adipose seed. That is identification of face because it is well preserved. Time since death. Cause and manner of death can be known. Injuries are preserved. Burial and include. Differential decomposition. Adipose seed and mummification seen in the same body. Next, we will discuss about this tachyonoid we have discussed, liver motifs, mummification done. Now, next we'll go for artifacts. What are artifacts? What are artifacts? Cadaver spasm done. We'll look for putrefaction, marbling of skin. And we have to also see for entomology of cadaver. Okay. So we have seen algamotis, liger, mummification, death, adipose, cadaver spasm, tachyonoid. So we have this one: entomology, putrefaction, marbling, artifact. Putrefaction. Let's see what is putrefaction. Putrefaction, it occurs in 3 stages. That is color change. It is by bacterial action. So this is disintegration of the body by bacterial action. It's called putrefaction. Here the bacteria is involved. The bacteria is involved here. Here the bacteria is involved. Okay. Color change, formation of gases, liquefaction of tissue. Mechanism: Clostridium welchii and the bacteria such as Streptococcus, Staphylococcus, diphtheria. B protein produces enzyme lecithinase, breaks the cell walls of RBCs and other cells. Putrefaction. Culture's first external sign of putrefaction is greenish color, discussion of skin overlying the cecum. Contains a lot of bacteria. It appears in 12 to 18 hours in summer and 1 to 2 days in winter. Later greenish discoloration spreads over entire body, chest, neck, face, arms and legs. Patches unite and color changes to purple, dark blue and then blackish. What is marbling? Marbling is superficial veins are stained purplish red. It resembles the branches of a tree. It's like branches of a tree. The superficial veins are stained purplish red. Site like neck, shoulder, roots of limbs, chest and side of abdomen. Mechanism: hemoglobin plus H2S, that is self-methemoglobin, greenish or purplish color. Hemolysis of RBCs in blood vessels with bacteria. Hemoglobin combines with hydrogen sulfide, methemoglobin is formed, which is greenish in color, stains the walls of blood vessels, infiltrate into tissues, give a marbled appearance. Onset 24 to 48 hours, early marbling sets in. It appears as greenish discoloration, superficial veins. 3 to 5 days, prominent marbling with dark branching pattern. More than 5 days, extensive marbling, bloating, and skin slippage. Medical legal important helps in estimation of time since death, indicates place of death, pattern progression, different for decomposition in water, air, and soil. Should be differentiated from antemortem rules. Again, mechanism is hemoglobin combines with, what's wrong with this pen? Hemoglobin. Hemoglobin, it combines with HbH2S and forms self-methemoglobin. Hemolysis of RBCs in blood vessels by bacteria. Hemoglobin combines hydrogen sulfide, self-methemoglobin is formed, which is greenish in color. And this stains the walls of blood vessels, infiltrate into tissue, gives a marbled appearance. So, seen about putrefaction is the disintegration of the body by bacteria, by bacterial enzymes, okay, by bacterial action. Color changes, formation of gases, liquefaction of tissues. Medical legal importance, like mostly Clostridium welchii and other bacteria, Streptococcus, Staphylococcus, diphtheria, B. proteus, produces enzyme lecithinase, breaks the cell walls of RBCs and other cells, leads to putrefaction. Color changes, first external sign of putrefaction, greenish color, overlying the cecum, then it spreads to the whole body. Later, greenish discoloration spreads over the entire abdomen like that. Patches unite and the color changes to purple, dark, blue, and then blackish. So this putrefaction, medical legal importance, time since death, estimation, and indicates all that. Okay, marbling is what? Superficial veins are stained purplish red. It is because hemoglobin, hemolysis of RBCs in blood vessels by the bacteria. The hemoglobin combines with H2S, forms sulfate-methemoglobin and greenish color, and it will infiltrate the tissue, blood vessels, and give a marbled appearance. Mostly neck, roots of limbs, chest, sides of abdomen. All this can be seen. It helps in estimation time since the place of death. Okay, pattern and progression of different decomposition in air, water, and soil should be differentiated from antemortem rules. Okay. Okay. So 24 to 48 hours here. It means early marbling sets in. It appears green in color. It is green. Then 3 to 5 days. Then prominent marbling with dark branching pattern. More than 5 days, extensive marbling, bloating, and skin slippage. Next is entomology of cadaver. See, entomology is the study of insects. So, fancy entomology, application of knowledge of entomology for administration of law. Mias is infestation of body by maggots or housefly. So, how is the development of housefly there? How is the development of housefly there? Let's see. How is the development of housefly? So, there is adult fly, then eggs are there, then larva is formed, then pupa is formed. Adult fly, it will lay the eggs. So after 1 day, it will form larva. After the 5 days, it will form pupa. After pupa formation, after again 5 days, housefly. So 1 day to convert into larva, 5 days, 5 days. Total 11 days are required to complete housefly, adult housefly. Larvae or maggots are white in color and segmented. Measuring 1 to 2 mm, they burrow the tissues by producing proteolytic enzymes. Next is artifacts. Let's discuss artifacts. What artifacts? Carbon dating. Mummification is done. Artifacts. Write about artifacts. What is Casper's dictum? Body decomposes in air twice as rapidly as in water and 8 times as rapidly as in the earth. So body decomposes air twice as rapidly as in water, times as rapidly as the earth. So हवा में वाटर में 2 गुना ज्यादा फास्ट होता है, अर्थ में 8 गुना और ज्यादा फास्ट होता है. Okay, now some questions. For estimation of times in death, all the following criteria are necessary except rate of rise of temperature per hour, vector temperature, rate of fall of temperature per hour, normal body. Rate of fall देखते हैं, not in rate of rise नहीं. One is A. Which of the following statement is false for alga mortis? Female bodies cool slowly. Yes. Body cools faster in death due to sunstroke. No. Human body during cooling does not follow Newton's law. Yes. Body does not cool faster if it is wrapped in cloth. Yes. Option B. Which of the following statements for lividity cannot be shifted after 8 to 12 hours? Yes. Rigor mortis takes 1 to 2 hours to develop completely in body. Yes, it is false. Not 1 to 2 hours, 12 hours. Time required to the mummified body is 3 to 6 months. Yes. Light meal takes 2 hours for gastric emptying. So option B is wrong. So what is the time required for gastric emptying? Approximate is light meal 2 hours, medium meal 4 hours, heavy meal 6 hours. First carbs, then proteins, then lastly fat empties the stomach. These artifacts. This was about it. Artifacts will continue in next class, or else I'll do in this only 1 minute. Artifacts will